Why do we see patients who have hip dysplasia and labral tears? They usually occur together, and there's a reason for that. Hip dysplasia is an anatomic issue where the hip joint is underformed. It's been that way since birth. Essentially, the hip is a ball and a socket joint, and when the socket is tilted or too shallow, the ball doesn't effectively fit under the socket. The labrum is a ring of cartilage around the edge of the socket, and so if the socket is shaped like this, you can imagine the ball will actually sit on the edge of the socket, and that's what tears the labrum. You can certainly fix the labrum then, but the problem is if you leave it in the same position, then the same thing is going to happen. That repaired labrum is then going to get crushed again by the ball, and the same issue is going to come back. And if that happens repeatedly, you develop arthritis, early arthritis. And so our goal here is if we see someone with an underformed socket and a labral tear, is we want to do two things for the patient. Number one, fix all the stuff inside the joint, fix the labrum. And then the secondary thing that we do, which helps, is to move the cup over to its proper position. When the cup is in the proper position, that socket and cup come together, and the pressure is actually inside the cup. It's no longer on the edge of the cup. And so that reduces the risk for a re-tear of the labrum. And we call this a hip preservation procedure because if you haven't developed arthritis, this will cease progression of any arthritis that you may see. If you come in early enough and there's no arthritis already present, this will prevent it from becoming an issue at all. And the idea is that we want young, healthy people to continue to use their native hip joints, hopefully forever, but at least add several decades to their hip joints before they have to have a hip replacement or any other kind of big surgery on their hips.